Well, good morning, everybody. My name is Grace Whiting. I'm the president and CEO of the National Alliance for Caregiving, and I am very excited to share with you findings from our new report on caregivers of individuals, both adults and children, with inflammatory bowel disease. And we have undertaken this work as a partnership with two of the leading patient advocacy groups in the space, the Crohn's and Colitis Foundation and the ImproveCareNow network. And so this morning, we're gonna tell you why this work matters. We're gonna walk through some of the data, and we're gonna give you some perspectives to really think about this work, why it matters, and what the context is relative to the autoimmune community as a whole. Before we get started, I just want to thank a couple of folks who have really made this work possible. Dr. Robert Hinton has been a key advocate for this work and has participated in getting it off the ground on behalf of the David R. and Margaret C. Clare Foundation, who has funded this critical study. Our researchers at New Mexico State University, Dr. Joe Tamaka and Dr. Michelle Banner, conducted this research after getting input from our advisory council members and many of the people here in this room. And because we're in Washington and we're in this fancy press club and we're thinking about policy, I would be remiss if I didn't recognize the leadership of members of Congress who are really moving the needle on issues related to Crohn's disease and ulcerative colitis, particularly the U.S. House Crohn's and Colitis Caucus, and then on the Senate, champions such as Bill Cassidy from my home state of Louisiana and Chris Murphy from Connecticut. Their support and interest in this report has been incredible, and the fact that they're looking at this, they're thinking about caregiving in a new way, I think speaks positively to some of the other momentum we're seeing on the topic. I also just want to mention that the Assisting Caregivers Today caucus is a bipartisan, bicameral group that's also looking at caregiving issues across the lifespan. And I see this report as one opportunity to continue that conversation about the need of caregiving, not just as an aging issue, but as something that affects us from when we're born through the end of our life. Finally, I just want to give a shout out to my team who made this amazing event possible, notably Karen Marshall from our advocacy department and Charlotte Davidson, who's one of our fellows, Pat Hines, who's our VP of Strategy and Operations, who helped direct the beginning of this report and much of the survey work, and then Lauren, who you've seen maybe running back and forth, helping us to just make it happen. And so without them, this work would not have happened. Now, with that, what I'm going to talk about today and what we're going to talk about is the perspectives of people living with the disease, the report findings, and the reaction panel. And if you're wondering about the title of the report, when we were going through the study, there were some qualitative responses. And one of the parents said, essentially, that being on this care journey was a roller coaster ride, that there are great wins, but there were also great disappointments, and that parents are sometimes less resilient than the person who's actually living with IBD. So that the disease doesn't have to define you, but it does shape your day-to-day life. And that struck us in the sense of it's different than the caregiving journey for dementia or the caregiving journey of aging, because this is something that is chronic, it's intermittent, there's flares and it comes and goes, and that intensity came out loud and clear in our report, and it's something that we wanted to talk about today. Before we dig in on the perspectives from our families, I just want to mention, if you're not familiar with it, inflammatory bowel disease is a collection of diseases. It refers to both Crohn's and colitis and ulcerative colitis, and these are autoimmune disorders. Sometimes people think that these are not intense conditions or that this is something that sort of, creates some functional limitation, but these are actually autoimmune conditions. They are medically incurable, and they can be extremely painful because your body essentially attacks your digestive system, and it can happen anywhere along the GI tract for Crohn's disease and ulcerative colitis, which focuses in on the large intestine of the colon. For many people, it causes intense abdominal pain, a number of GI-related symptoms, and as well as weight loss and fever and hospitalization. And that gets back to that roller coaster effect, like you're going into the hospital and you're coming out, and the interruption that the disease creates for people and their families. Typically, we're looking at a group that the onset of the disease happens between 15 and 35, and we know that the incidence is actually increasing in children. So with that, we're going to start and hear from the families and the caregivers who are on our panel, and they're going to tell you a little bit about their perspectives on IBD and why this work matters. So Steve and Dr. Wolf, if you'd like to kick us off.
Thank you. Good morning, and thank you for joining us. Soon you'll be hearing the perspective of adults with inflammatory bowel disease and caregivers for those adults. I'm here, though, to represent the experience of a parent of a child with inflammatory bowel disease. As just mentioned, the disease typically has its onset later than my child experienced. My daughter was diagnosed at age 7, became symptomatic a few years before that. It took some time before we established the diagnosis of Crohn's disease. She's now 17 years old, getting ready to apply to college. But because she was diagnosed so early, she has never known, she has no memory of a life without inflammatory bowel disease. For parents, getting news that your child has been diagnosed with a chronic disease is a traumatic incident. It gives you a sense of powerlessness, lack of control. You want so much to have control over your child's future, and the disease seems to have its own mind. As you might imagine, parents having to take care of a child with this or any other chronic disease are faced with a lot of physical and logistical demands. The ones that you would typically come to mind would be all the doctor's appointments that have to be arranged and attended to, all the tests that have to be performed, which in the case of inflammatory bowel disease can range from relatively simple tests like blood tests to more invasive procedures like colonoscopies. There's a lot of logistics to work out with school and accommodations and working with teachers to help them understand why the child has to keep leaving the room or maybe affecting academic performance. And then there's all the treatments that need to be administered at home. Our child had refractory disease, meaning that it did not respond well to normal medications. So she required lots of injected drugs, and at one point could not take any food by mouth and had to receive her nutrition through an NG tube inserted through the nose, which she self-inserted. But along with those physical and logistical strains, it is important to also emphasize the emotional toll that a chronic illness like this takes on. As mentioned, children are pretty resilient, so our daughter pretty much rolls with this. I wish the parents were as resilient. And so for many of us who are parents, we find it hard to deal with the emotional strain. There's a fair amount of depression and stress that occurs among caregivers dealing with this condition, both for those who are dealing with adult patients and pediatric patients. I have to wrap up, but let me just add that I happen to be a physician. And in my medical training and practice, I was always aware in a cognitive way that my patients who had chronic illnesses had to deal with both these physical and emotional pressures. But I have to say I have never really understood how bad it is until I finally had the experience myself of being a caregiver. And our ability to manage the logistics of getting appointments, getting questions answered, understanding test results, even though the parent was a physician, was challenging enough that my wife and I often comment on how difficult it must be for people who don't have an education or perhaps don't even speak English to try to care for their children or for themselves when they face a chronic illness like this. The challenges have to be even more demanding. So with that, I'll close and let my colleagues speak.
Thank you so much, Stephen.
Good morning, everybody, and thank you for joining us today. And Grace, thank you for having me to share my perspective as a caregiver of a Crohn's disease patient. So if you'd asked me when I was a 20-year-old college student where I'd see myself down the road, I never would have thought I'd be a caregiver for someone with a chronic illness. But when I was a junior in college, I met a guy, like a lot of other women my age do. He knocked on the door to my apartment on move-in day and asked for toilet paper. We didn't start dating until 6 months later, but the story of how my husband Dan and I met is still one that we find ironic to this day. Dan was diagnosed with Crohn's disease just 2 months after we started dating. The first few years he lived with the disease, he was still under the care of his parents. So I knew he was sick, I knew he had a digestive disease, but I didn't really understand what his disease was and how serious it was. In fact, I don't think I fully grasped it until we were married, living 2 hours away from our support system, and I became his primary caregiver. We decided it was time to transfer his care to a doctor closer to us who scheduled a colonoscopy. It turns out that his disease had progressed to a point where he had developed a severe narrowing in his intestine. When the gastroenterologist went to push the scope through, she ended up perforating the wall of his intestine. Within 45 minutes of waking up from the procedure, Dan spiked 104-degree fever and kept saying he felt like he was dying. This was the first time I truly got how debilitating, devastating, and terrifying Crohn's disease could be. And it was the first time I grasped what it meant to be a caregiver. I'll never forget, the doctor wanted to rush him to get a CT scan to confirm the perforation, but when they tried calling our insurance company, nobody answered. They were out to lunch. Who knew insurance companies take lunch breaks? I went on a warpath to get the scan approved because I wasn't going to sit on the sideline and watch Dan get sicker and sicker while we waited for the pre-certification. So I authorized the scan without insurance approval and decided I would fight tooth and nail if they tried to deny coverage. After the perforation, Dan was hospitalized 2 more times over the course of the year, including one where he had surgery. These 2 hospitalizations occurred shortly after I started a new job. I was terrified that my new employer would look down on me for having to miss so much work. But I was lucky as they were willing to help me through this difficult period. They approved me working a modified schedule for 2 weeks, half remote and half taking time off. This allowed me to be present for Dan during his first 2 weeks of healing after his surgery. So for 6 weeks post-op, I slept on an air mattress next to the bed in our bedroom so that I wouldn't jostle him in my sleep. I set alarms and woke up throughout the night to make sure he took his medications as scheduled. I helped him bathe and use the bathroom. I forced him to go on short walks and cooked him special low-fiber, low-residue meals. He was actually in graduate school at the time, and so I went on his behalf to his first class this semester to get his syllabus and other materials. For me, being a caregiver is a second full-time job. I celebrate the highs as if they were my own. I've cleaned the car on several occasions after he soiled himself. I've spent hours on the phone with our insurance company fighting coverage denials. I found financial assistance programs to make sure we can afford his medication, which, as Steve mentioned, he's on one of the infusions, which is exorbitantly expensive. I have a very close relationship with his doctor. We're Facebook friends, and I have her cell phone number, which is not normal. And ask the questions that he doesn't necessarily want to ask, such as when is he due for a colonoscopy. I put Dan's needs ahead of my own, even when he's in remission. And I feel lucky that I've been able to turn my caregiver journey into my full-time career, working to help support and empower other IBD patients and caregivers. The results of this survey highlight how IBD caregivers like me need more support and resources to navigate their caregiving journey. When Dan first got really sick, I tried to find others who understood not only what Dan was experiencing, but also what I was experiencing as his spouse and his caregiver. There was very little available to help empower me in my caregiving journey. So I applaud the National Alliance for Caregiving, the Crohn's and Colitis Foundation, and ImproveCareNow for exploring the experiences of IBD caregivers and highlighting the needs and gaps that need to be addressed. Thank you.
Hi, everyone. Thank you for having me. Up until January 2017, I had never known what it was like to live as a healthy person. I've never known a life without Crohn's disease. I started out as a sick adolescent and grew into an even sicker teenager who was medically neglected. My mother would schlep me from specialist to specialist as recommended by my pediatrician for answers we never received. They were followed by accusations. She was enabling my bad behavior because I wasn't eating or going to school enough. She was accused of Munchausen by proxy, but she persisted. My mother's plan was to be a stay-at-home mother until I went to school. Okay. As plans do, that changed. She worked part-time, but often was tending to my health issues. I don't think she would have been able to swing a full-time job and manage my health issues. We were privileged in that my father owned a company and we had health insurance, so that enabled my mother to stay home. However, my father had to work from sun up to sundown. So while he wasn't there to take care of my health needs, he was providing for the family. And that was his role. I missed a lot of school growing up, and maintaining friendships wasn't really a priority for me. I was in and out of school often, and when you're gone for a couple weeks, coming back in, social circles change so often, it's hard to find where you're supposed to fit in. So throughout my teenage years, it was hard to maintain solid friendships. That being said, along the way, I met someone who didn't give me a say in becoming friends. She chose for us, and that was that. She was there when I went to finish my degree. She was there when I came home from graduation and was very sick. She was there when I finally was diagnosed with Crohn's disease at the age of 23. I was there when she got engaged. I was there when she got married, when she gave birth to my godson, Noah. On Noah's first night in the hospital room while his mom and dad slept, I promised him the world and everything that came with being his fairy godmother. When Noah was born 7 years ago, on September 20th, I was in the worst flare of my life. I lost my job, I was forced to sell my house and move back in with my parents. I was riddled with skin manifestations of Crohn's disease and debilitating arthritis in my hands and feet. Yet I made the 3-hour drive south to be there for his birth because I wanted to hold him before I could possibly lose the use of my hands completely. I wasn't sure what the future would hold, and I wanted to soak in every moment. Little did I know when I promised that little nugget that I would do everything in the world to keep him safe, that my words would be tested much sooner rather than later. At about 1.5 years old, Noah wasn't growing like his age group. He had trouble keeping formula and now food down. By age 2, we were rushing him to the hospital when one day he couldn't stop vomiting and he looked like a little skeleton with a giant head. I don't know exactly how it progressed that way, but you just notice one day that something doesn't look right. It took many more hospital stays and another 2 years before he was finally diagnosed with Crohn's disease. We had an issue with finding a doctor who would actually perform a colonoscopy on a 2-year-old and later a push enteroscopy on a 5-year-old. During Noah's Crohn's diagnosis journey, his parents were accused of malnourishing him, not forcing him enough to eat. They were too lenient. He was too picky. Little did we know that he also had a rare disease called EOE to top things off. His mother works full times, and her benefits were better. So she's the primary bread maker. His father is the full-time caretaker. He works nights. She decided to take a job that would enable them to have better benefits, or so she thought, and be closer to home since he has so many needs. He has 4-week infusions. Unfortunately, he's no longer allowed to see his primary treating physician, and he's stuck in a medical system through her insurance company that doesn't have specialists for Crohn's disease or EOE. So we're kind of back to square one and just trying to keep him afloat. This disease also affects his ability to retain information. Learning is an issue. Being in school enough is an issue. And these are all items that while she's working full time, she also has to be at the school and at the hospital to fight for her son. She also has to manage his diet. Having this rare disease along with Crohn's requires specialized dietary needs as well as making sure he doesn't get fed certain foods while he is at school because they can exacerbate both conditions. Data provided by the study show that 59% of caregivers like Noah's mom and my mom have experienced emotional stress. 49% felt overwhelmed. 35% felt guilty because they thought they should be doing a better job of providing care. More than 6 in 10 reported struggling with sense of loss over what the care recipient's life would have been like without IBD. I don't know what my life would be like without IBD. Noah's lived the same life and he's only 7. But I certainly hope for the future that he won't have to think about it in the same terms that I have. The survey's results hit close to home for our families. While I never know the true depth of what my mother experienced during my formative years, and again, while caring for me prior to this treatment that restored my health, I've gotten a taste of what she started to go through while caring for Noah and helping make medical decisions for him. Both my mother and Noah's mother have received 0 support as caregivers of someone with IBD. This study proves it is so desperately needed.
Thank you. Thank you both. So, Rebecca, and Jamie are going to come back up after we talk about the findings for a reaction panel. So thank you all so much. Through the data, the science, and I'm going to encourage you, if you have not, there are beautiful, beautiful reports that have been handed out, to grab one of the reports. Excellent reading for the plane or in a cab, or even to share with your friends. We've got a whole bunch, so feel free to grab some and take them on with you. When we look at the data in this report, a couple of things just to know about the study. So this is a study of just over 700 caregivers of adults and children that have IBD. And we're looking at primarily unpaid caregivers. So these are people who are not, for example, a direct care worker or home care worker, but these are people who are friends, family members, neighbors, partners. The other thing to know is when we look at this type of caregiving report, it's often difficult to find people who are willing to participate in research. So we think that these data that I'm about to share do a good job of explaining the major issues facing these families, but the data is not representative to the whole U.S. And there's a need for more research, deeper research, and research that captures the perspective of diverse populations. In addition to that, I would just note that throughout the report, you'll see different representations of the data in terms of this is data where of these people that answered yes to one question, this is how that breakout group responded, versus this is everyone who responded in the survey. And so I'll try to flag that as we go through. Now, 3 big pictures from the report. Number 1, caregivers are members of the care team. They help actively manage care. You know, you could even say that they're sort of multitasking superheroes, because on average we found in this study at least that people spent at least 20 hours a week just communicating with medical staff, insurance companies, schools, and managing medications and finances and preparing meals. We also know that managing chronic disease is a roller coaster. In this case, about 81% of the caregivers said that they work full-time or part-time. And so what we saw is of that group that were working, 9 out of 10 said that providing care caused them to miss work. So think about that type of interruption that the disease has, not just on the person who's living with it, but also that friend and family member. And then the last is care is not without cost. We talk about unpaid family caregiving, but there's an emotional cost, a physical cost, and a healthcare cost to the person who is providing that care. And we're going to dig in a little bit on that as we walk through some of the data. Now, I love charts, so I'm going to walk through some of the charts. If you are having trouble seeing the charts, again, I would point you back to the report, which provides not just the charts, but also some detail and color around the data. So thinking about the caregiver as a member of the care team, the first thing I would say is in this study, the majority of people who responded were caring for someone who was their son or daughter. There was about a quarter of people caring for a spouse or partner, and people who are also caring for older relatives, such as their mother. We had about 2% of the respondents here, and then 3% caring for other types of relationships. And what do they do besides everything, right? Like, I think we got a sense of the panel up here that people are doing everything, but there are also very specific ways that we look at caregiving. The first is activities of care. So you can see the blue bar is the percentage of people that are performing tasks. So not surprisingly, 9 out of 10 IBD caregivers are helping with meal preparation, special foods, and diets. But you have roughly a third helping with a number of other activities of daily living. And we think of these as high-touch activities, such as helping somebody get dressed, go to and from the toilet, getting bathed or showered, or even dealing with incontinence. We also look at what's called instrumental activities of care. Things like attending appointments with physicians, talking with physicians and nutritionists, providing transportation. And you'll see the vast majority of caregivers of someone with IBD are doing these types of instrumental activities. And the reason that matters is because this is the type of activity that a care manager might normally help with, or a medical social worker. And so we have this friend or family member who's really taking on something that's normally done by a professional on the care team. The third big area of need when we talk about caregivers being members of the care team are medical nursing tasks. And you'll see, for example, 73% of caregivers are helping to give medications or to give injections. We also see 15% that are doing ostomy care. And we even see 18% that operate hospital equipment, such as beds, wheelchairs, or suctioning tubes. Now, I'm always shocked by this, but whenever we ask this question across all disease states, one of the things that emerges is that the majority of people who are doing medical nursing tasks do so without any prior preparation. And this is the breakdown of that for this population. 63% of the caregivers in this study who were helping with medical nursing tasks had no prior preparation. So imagine the stress and strain of your neighbor coming over to help you with your ostomy bag, and no one has shown them how to do that. That is the intense amount of strain that many of these families are facing, and I think the gap from the medical system. It's also worth noting, particularly because of our partners in this room, that people who are caring for someone with this condition are patient advocates. They're communicating with the professionals and also advocating within systems of care. So you'll see 86% are communicating with healthcare professionals, 85% navigating those systems such as school, and you also have 83% monitoring the severity of the condition. You even have caregivers playing that role of educator, explaining to the physician, no, this is what the disease is about. This is the type of care this person needs. And that is a role that's not always easy to take on, but we know time and time again, family members are experts in the disease. We also asked about what type of support services do you need and have access to. So the red numbers in the bubbles are the difficulty of getting access on a scale of 1 to 5, with 5 being most difficult to access. And what was interesting to me is you can see that 61% of people wanted access to complementary alternative treatments, but it was relatively hard to be able to actually find them. And so there were 2 breakouts of this in the report. And there were areas where what people wanted, they really did not have access to. And a lot of it, in particular, that surprised me was around clinical trial engagement. People wanted access to be able to participate in clinical trials, and it was difficult for them to be able to do that. Now let's talk about the roller coaster. This is the question about, of the people who are working, what is the effect on your working condition? And you can see that 9 out of 10 people went in late, left early, took time off work so that they could provide care. More than half of people said that their performance suffered, and nearly 40% had to take a leave of absence from work. And then you have roughly a third who went and actually had to reduce their working hours. And part of the reason this is so important for this group is when you look at the question about how people are paying for care, many people are on employer-based plans. So you can imagine, for example, spouses where husband is working, wife has IBD, and both are on an employer-sponsored plan. So a move from a full-time position where you have health care and access to insurance to a part-time position because you have to take on responsibilities of care has a ripple effect on other pieces of the health care delivery process. Likewise, we saw of the people who were students who were providing care that they had interruptions in school. So they had trouble paying attention in class. Sometimes they missed class in order to provide care, roughly half of folks. We saw a little over 40% missed an assignment or an exam, and even nearly a third of people who actually dropped a course because the care responsibility was so great. And then there's a third piece of this, which is that caring is not without cost, right? It costs us something physically, it costs us something emotionally. And one of the things that we heard this morning as I was listening to these perspectives is it impacts our relationships, right? We want to be the friend or the daughter or the spouse or the partner. We don't necessarily want to be the home care aide or the nurse or the social worker. And so we asked questions about how is this impacting real families? And so what you see here are some of the responses of the caregivers in this study saying that they felt this type of strain was high, either extremely high or very high. And so you can see half of people felt overwhelmed. You had more than a third that said they had feelings of guilt because they wanted to be able to do a better job of caregiving. And you also had 13% said they felt guilty because they secretly wished that they didn't have to be a caregiver. And part of that, I think, speaks to the need to support these families so that they can enjoy those family relationships and they're not being pulled in so many different directions. And then 16% experiencing depression from the caregiving experience. There was also, and we've seen this in other studies, a sense of loss. And that sense of loss can sometimes impact the way that people actually provide care. So more than half of people struggling for a sense of loss of what their life could have been like if they had not had IBD. They experienced stress or anxiety because of an increased risk of cancer for the person who has IBD. And 30% felt like they didn't have enough information about how to provide care, and that created stress and anxiety. The good news, I think, is there are solutions for this. So when the caregivers in our study started to identify the impact on caregiver health, these are things that programs and services and access to healthcare for the caregiver can address. So for example, you've got 40% of people saying they didn't get enough sleep, but you can imagine from a policy perspective, a world in which we're able to bring in additional caregivers to give that caregiver a break, to give them some respite. You can see 33% said they were unable to exercise as much as they would have liked to exercise. And so innovative programs that allow families to be able to exercise together to bring that back. And then you've got issues with fatigue for the caregiver, as well as insomnia and increased or decreased appetite. So a lot of the things we think about in terms of healthy living would be useful not just for the caregiver, but for the entire family that's impacted by IBD. There's also the social impact, difficulty maintaining networks. This is something that we've talked a lot in Washington about lately, that sense of isolation and how do we address that. And so thinking about these roughly 20% of people who are experiencing some type of isolation, how do we bring them into the community and how do we let these folks know they're not alone in this experience? And there's mixed emotions. I mean, this is always interesting to me because sometimes we do talk about caregiving. It's like, oh gosh, there's just a lot of things here that are going on that are really bad. But the reality is that people wouldn't be caregivers if it was a wholly negative experience. People do it because they love the person that they're caring for, or they have a sense of duty or honor to care for them. And so when this question we asked, has this had a positive impact on my family? And so the blue bars are yes. They said yes, they experienced this positive emotion. Green saying no. So for example, we had a third of people say that there was a positive impact from caregiving. We had 23% say it gave them a sense of purpose in their life. And we see more than half of people said they took pride in being able to understand this medical condition, which is an exciting thing for patient advocates to be able to say, like, you've learned and understand how the medical system works. And more than half felt valued as a part of the healthcare team. The other thing to just leave on, as we think about this discussion, is there's also cost of care that we don't always pick up on or think about as actively. And so you've got the immediate, the difficulty with finances. So more than a third of folks stopped saving. They reported that they took on personal debt, that they used up personal savings because they were having difficulty getting access and affording care. You had 22% who paid bills late. And we also saw in the comments like this concern about access to care, and particularly volatility, or like the challenges around what's going to happen with the Affordable Care Act. What's going to happen if I change jobs and I don't have the same access to insurance that I had before? And that stress and tension, is something that came up again and again when people were concerned about, I'm caring for this person, and this is sort of a basic need in order to care for them. I want to highlight 4 gaps that I think are opportunities. Clinical trials, you had 28% of people that sought them out but could not access them. Training, again, on the medical nursing task, helping people understand how to be great partners in care. getting access to needed treatment. We had nearly a quarter of families who said they could not get access to needed treatment. And support, respite care, taking time off work, information, counseling, help navigating insurance, really recognizing that the caregiver is a partner in care and they are their own human being. They need their own supports in order to really focus in on that relationship. I would also just note that we have some policy recommendations that are broad, and these are general areas where I think there can be more done. One is more research, particularly increasing funding at federal agencies such as the CDC, the FDA, and others to really understand how caregiving is impacted from a health system perspective. Ensuring financial security for families, improving the delivery of health coach services, and really supporting the health and well-being of the caregiver, not just as that care provider, but as their own person. So what we're going to do now is we're going to have a reaction panel, and I'm going to bring up our colleagues, as well as my colleague, Randy Ruda, who is an amazing advocate. He's the former CEO of Easter Seals, and he's here representing the autoimmune community. And he's going to put this in the lens of how does this work, this caregiving work, really impact those larger conversations about autoimmune disease. I'm also excited that Laura Wingate's going to come up here. She is a policy wonk, and I mean that in the most positive way. Brilliant policy mind, and we had a chance to catch up last night over dinner, and she's going to provide that lens, as well as Jamie and Rebecca are going to come up from the perspective of caregivers, and then we're going to open it up, and we want to hear from you guys. So
thank you so much, Grace, in so many ways for engaging us in this wonderful discussion concerning caregiving and the autoimmune community, in this case specifically people with Crohn's, colitis, IBD. What is their journey? What is their experience, and bringing it forward in such a thoughtful way. The insights, the comprehensiveness, the application of this research gives all of us a tremendous platform from which to respond to people in our own lives and to people that we see in society or who we're advocates for, colleagues with, to really tackle these issues in a way that's truly meaningful. As Grace mentioned, I'm with the American Autoimmune and Related Diseases Association, and that's an organization that advocates on behalf of patients and their families, policymakers, and stakeholders across the autoimmune spectrum. And we're talking about there some 50 million Americans who have one or more autoimmune diseases, and there are more than 100 autoimmune diseases that may affect different parts of the body. Basically, autoimmunity is when your body goes into overdrive against its own tissues. And each of the different areas of autoimmune disease speaks to the part of the body that comes under attack by this overreaction of the body itself. And then that can be complicated by environmental factors and other factors, including just other kinds of things that might affect people's health in a way that then creates the challenges that we're talking about today and that this study really helps bring forward. The journey of people with autoimmune disease, and I think you heard that expressed in some of the conversations that you've heard so far, really speak to a journey that is oftentimes lifelong, increasingly as we see more and more young children affected by autoimmune disease, including Crohn's and colitis and IBD. So it's something that is with us over the course of a lifetime, which means it's with us in family, in community, in the context of work and school, in a way that some other diseases may not be. And so I think it challenges caregivers, it challenges these systems and supports to think about how we can be more effective over the course of a lifetime in promoting the health and well-being of our family member, ourselves, and those that we care about. And in that way, this research is extremely helpful in helping us understand through the lens of Crohn's and colitis the experience of people with autoimmune disease across that full spectrum. Many of the things that I think the study shows, that the research is going to show, speaks to some of the systemic issues, the human experience issues that everyone faces when challenged by a healthcare condition. And so I think part of what we're talking about here are the systems, ways in which the system itself may be, if not broken, certainly could be more effective in supporting caregivers and people with chronic conditions such as autoimmune disease. And it also speaks to the human needs, the realities within health and community that all of us share, and yet we don't necessarily focus on until something challenges us. It gives us a perspective when we ourselves develop a health condition or challenge, or when a family member does, or someone who's in our circle. These are the kinds of things then that cause us to think about treatment, access, affordability, support systems, the realities of just living your life when also you're juggling the challenges of an autoimmune disease in this case. And I really like the way that the data not just called our attention to those different areas in which caregivers and people with autoimmune disease are affected, but then do point out the gaps, gives us a place that we might consider to go forward. And that's something I think will be tremendously valuable to the entire autoimmune community. And it's in my experience in looking at what this report brings forward, and I certainly think that Laura will have any of our speakers here, but Laura in particular, who's really looked at this kind of across the spectrum of healthcare and chronic conditions, would verify that these gaps, the kinds of solution strategies that we might want to take forward from this research, will really help improve healthcare. Period. Because in many ways, the presence of a chronic condition, the presence of a disease or an experience in healthcare that's not an acute, something happens, you go to an urgent care center, you get a treatment, maybe it's an antibiotic, and boom, you're out of the system. That's kind of the normal experience for 85% of the population. Many of us have had that experience. But what we're talking about here is how does the system respond, and how do we as caregivers and individuals around people or ourselves that are affected by this disease differ in our experience if we've got a condition that then is with us for a lifetime. And then I think what this research uniquely brings forward, and again, very germane across the autoimmune experience, is what about that condition, which may be with you for a lifetime, but it presents itself or challenges us in different ways over time. And that's that intermittent nature, which I think in many ways is if not unique, certainly a characteristic of what people with autoimmune disease need to take into consideration, and what we as advocates and champions of those individuals need to consider as we become part of a support system or an advocate for change that better supports people with Crohn's, colitis, IBD, and other conditions that could be an impediment to them for contributing everything that they are and everything that they bring to the table in their families, in their community, in their workplace, their place of worship. We want to liberate both the individual and the caregiver from those challenges that we can address in a way that then everybody has full value in what everyone wants to contribute. So let me switch to asking our panel, because I know you've thought about this data, you've been looking at the report, and again, thank you so much to your organization, which is an amazing organization in the autoimmune community and just in American healthcare generally. Thank you to New Mexico State University for their support in research, and for ImproveCareNow for playing the role that they're playing. I really appreciated Dr. Stephen Wolf's comments earlier, both as a practitioner and as a parent. These are important perspectives for us to think about. But I'd like to just kind of open it up to you first, and then Grace, I think you're going to invite the audience to engage. But as we looked at some of the findings, and I just picked out a few, I think maybe we'll kind of begin and end with some of those gaps, because those are places for us to be particularly attentive to and respond to. But maybe I can start with you, Jamie. You talked about just your own experience as you yourself kind of grappled with the understanding of Crohn's and colitis, and then also other conditions, Crohn's disease and other conditions that you might have. And talk to me a little bit about that day-to-day journey, because I don't know that everybody realizes that in the autoimmune space, and it differs from one condition to another, just the ability to get a diagnosis can oftentimes be 3 or 5 or even 7 years long. Think about the stress that's associated with that sense of what am I affected? What's affecting me? You heard several of our speakers talk about having people within the community, people within the healthcare sector, people within the schools maybe challenge you and even say, well, maybe you're overreacting. Maybe you don't have a condition. Maybe this is something else. I mean, not only is it a late arrival to diagnosis, but sometimes it's really questioning the person who knows their own health the best, and their caregiver knows that person's own health the best. From even understanding what it is they're dealing with, and talk about a stressful situation. So, Jamie, talk to me a little bit about just life. How are the day-to-day aspects of life affected, particularly when you have a condition that may be, less problematic for you 1 week, 1 month, 1 year, and then very challenging, the next day. How do you position for that in terms of your own planning and structuring your life and kind of helping those commitments around you that might be work or school or other things, understand that journey?
It's a loaded question. Starting out being sick so young, but not having a diagnosis and struggling to get a diagnosis was an issue unto itself. We had people from the school come at my mother threatening to send her to jail for being tardy too often, being absent too often. She even moved me to a different school so that I would be closer to home because it would be quicker for her to come and get me if something were to happen. And a school board member threatened her because that school was not in our district. So it was very interesting to see how these things played out growing up, knowing what I know now that I have a hard diagnosis in hand, and the way things have progressed today with legal safety measures. Everything is completely different. It was like the Wild West back then. However, it doesn't mean that things are great now. So my nephew has his diagnosis. He is in the first grade. We had to fight for him to be in the first grade because of how much school he missed during kindergarten. And now there's testing measures in kindergarten. These kids are not kids anymore. They don't get to learn at their own rate. There are measures that have to be made, and these teachers' paychecks depend on him meeting certain milestones. But meanwhile, we're just trying to make certain milestones so that the poor kid can grow. He didn't grow for an entire year and a half. His 3-year-old sister, when he was 6 years old, was as tall as him. He just had a growth spurt for the first time. So we know that we're doing things right, but it doesn't mean that in the eyes of the people at his school, we're doing things right. And so it's very frustrating. From a planning aspect for me, for instance, today, I woke up extra early so that I could eat something small and just start getting ready for the day and make sure that I had enough time in case for whatever reason my digestive system wanted to speak up. I'm lucky right now, knock on wood, I'm in remission for the first time in my life. And every day I wake up wondering, is this going to be the day that the shoe drops? My nephew, for the first time in his life, is in remission for at least his Crohn's disease, not his EOE. So we're still doing this constant balancing act of keeping him somewhat healthy and also trying to maintain our lives in a way that we all aren't too stressed, because stress affects your health. I don't think his mother has slept since the day he had his first ER visit and then hospitalization. And I don't know if she ever will.
Well, Rebecca, anything to add from your experience?
I would say, so my husband has been in remission for 5 or 6 years now, basically since he had surgery. And what's hardest for me, I'm really good at handling emergency situations typically, but the longer he stays in remission, the more the small things that he might experience, like a random bout of nausea, rattle me. So the unknown and kind of the waiting for the shoe to drop is probably one of the hardest things that I find myself struggling to grasp, because I know it's going to happen, I just don't know when, and I don't like the unknown. Being an anxious person, it's not helpful. So I find myself, he has a bout of diarrhea one day. I start freaking out that his disease is coming back, and it's not just a one-day thing. So that's what I would just add on to that from my perspective.
It's interesting. I mean, a lot of that's just very practical management of day-to-day life, but that constant navigation and negotiation on your own behalf and on behalf of a family member is, as you said, it's stressful. It's all the kinds of things. And it causes you to have to stay up late at night, if you're not already up, doing the research, trying to find those solutions. Let me just ask you, all three of you, to comment. As I've spoken to people in the autoimmune community, I'm sure you've had these conversations both yourselves in different ways. There are a whole whole body of policies and supports that should be, that guarantee access, that protect against discrimination, whether it's from the Americans with Disabilities Act, that people in the healthcare space and chronic conditions may or may not even identify with, I found. There are guarantees for access to an education in the public school systems, things that should be a framework of protection that should help you. The Affordable Care Act and a lot of different legislation around access to health care at least gives voice, sets a goal of trying to not have these barriers be things that you would think you're having to fight through for the first time ever. And I certainly, parents in schools, sometimes they'll say, despite decades of having these assurances for my child, because there's a medical need involved, I have to fight that battle. Could, maybe Laura, could you start and then kind of come back to just comment on that? Because I'm just curious, how are we leveraging as a autoimmune, as a chronic condition community, some of those structures that should be there for all Americans?
I think it's a struggle for people to access and to know where to go for information. I think this study, when we got the initial findings, one of the things, it broke my heart because so many of the things that were being called out as gaps and lack of resources, the foundation actually has. And so that said to me that we need to do a better job of raising awareness, connecting to people. And I think the entire autoimmune community needs to try to increase our presence so people know that there are foundations like the Crohn's and Colitis Foundation, like ImproveCareNow, like the National Alliance for Caregiving, that have these resources that can help with navigating school and helping to explain the protections around 403 accommodations, so school accommodation, college accommodations, employer accommodations, and also getting patients involved and their caregivers involved with advocacy groups so that we can protect the Affordable Care Act protections, that we can move legislation around protecting access to medications so that patients do get access to the treatments that their physicians and they have chosen is the right treatment for them. So I think it's about awareness. I think it's about providing an easy way to get engaged so that people don't feel pressured but can leverage the resources and join a community over time that begins to support them and provide not only education and advocacy but also support.
Yeah.
I'll chime in. I come from an interesting perspective in that when my husband first got really sick when we first got married, I was working for a senator at the time who happened to have written the Family Medical Leave Act and was working on the Affordable Care Act. So I was lucky in that I had to drop everything that I was doing to go spend 5 days in the hospital with him, and they gave me no issue. They were completely understandable. They let me, skip days to go to different doctor's appointments, things like that. And they were really very supportive, and that's not something everybody has. I think the other piece is, particularly from my husband's perspective, he doesn't like to talk about his disease at work. And because of that, he has a fear of ramifications of, whether employers will look down on him, he might not get a job, things like that. But that also means he can't take advantage of the accommodations that he could request. Yes. So it's a double-edged sword, Luckily, the job he's in is very flexible. He can work remote periodically. For example, today he's getting his infusion, so he's missing work in the morning and going in for a meeting in the afternoon and then going home. So they're very flexible, but that's just one position. That's not every single job that's available out there to different patients. So I think educating more on accommodations and helping patients feel more comfortable in talking about it with their employer in a way that protects them legally, I think is an important gap that we need to be addressing.
That's great. Thank you.
Yeah. I'm in the position that I'm in now because I had left a job where I was protected as an employee and took a new position that was a better salary and better benefits. When they laid us off 6 months later, I couldn't afford the COBRA, so I had to pick up a personal plan. Went back to my former employer with my tail between my legs, hoping for my job back. They hired me as a contractor. So being hired as a contractor, I made $1 more, but I had no benefits. So that actually, on the back end, I lost money because I was now paying for something called a catastrophic plan. This was as the ACA was starting to come further after it had passed, but it still didn't have the same protections that we have now because it was so early on. Because of that, I had a $400 premium, which was actually more than my car payment. My deductible was $16,666 per year. So you can imagine, as a Crohn's patient, that I was not seeing my specialist because I didn't have one, because I was afraid of taking a day off where I would not be paid because I did not have sick days and I did not have vacation as a contractor. As my health became worse, I then had my job threatened, and eventually I did lose my job, which is where I spoke that I lost my house. I had to sell it and move back in with my family. When this happened, my mother said, please file for disability, because at that point the inflammation was head to toe from my Crohn's disease, and I also have psoriasis, and now we know also some of the arthritis is Crohn's related, called neuropathic, as well as psoriatic arthritis. Everything bloomed because I was not medicated, because I was not taking care of my health, because I was afraid of the debt, which I am now almost paid off of from 2012. We are now 2019. Because I was declared disabled, I was able to thankfully go on to my mother's employer-paid plan because I was diagnosed before the age of 26. It's a loophole that not many people knew about. We did. I got lucky, and therefore started getting better health care, and still had to fight to get on medication and had to go through the step therapy process, which actually made me sicker. And I am now permanently disabled due to my arthritis. It's hard for me to say that I think that I wouldn't be disabled if I was able to get care sooner. And I don't know exactly where to place the blame, whether it's on myself or insurance or maybe somewhere in the middle, but that's where I'm at. My husband now works for benefits. He is afraid of ever looking for another job due to ramifications. He only recently asked for accommodations because he has some of his own health issues, because he stresses so much worrying about me. My mother became ill with a condition that she's dealing with right now, and that took a toll on him worrying about missing work. And I know every day that anything happens at work, he constantly only thinks about one thing: will I be able to get my medication for the next month, and not about himself.
Sure. And I think that really speaks to a lot of people's challenges, in the autoimmune space, and I think that's true for people with Crohn's and colitis. You're hearing that certainly in Jamie's experience. Nearly half of people with one autoimmune disease are going to have others. And these diseases are going to run in families. Not necessarily the same disease, but you're something that is affected by the autoimmune system, just not behaving the way it should. And so that probably complicates things then as a family. You try to wrap around the support needs of any one individual. I'm also struck, and I know, Grace, we've talked about this in the past, that the caregiving role oftentimes does fall to the woman in the household. And you can find yourself in a sandwich situation where you've got elderly parents and young children with needs, and then you may find yourself in the autoimmune space, certainly more likely than not to be the person affected by one of these diseases. That has to bring its own set of pressures, or just adds to that juggling act. Would you agree that that's something that's out there? It
definitely is. Both of my parents have a variety of illnesses on top of my husband, and now I'm not being a primary caregiver for them, but a lot of times they'll call and talk to me about it. And because of how sick my husband has been and how familiar I've become with the diseases, when they start talking about GI stuff, I have to stop them and be like, are you sure you're understanding what you're being told correctly? Because this makes no sense to me. Like, my mom had a colonoscopy in which she told me they had trouble getting the scope in because her intestines were twisted, which is emergency surgery. But so it's definitely an interesting perspective in figuring out how to balance, the person you're primarily caring for, your own needs, and then the needs of other family members who have medical conditions as well.
And if I could just add on, I think that's these stories point out a lack of health literacy in our culture, and the ability to take this complex language that our medical system needs to use. We need to have these complex words, and the doctors are highly trained and nurses are highly trained. but we need to bring down the language to the everyday person so that we can understand, and that's particularly important for the insurance area. That's one of the resources the foundation recently launched was about financial management and insurance navigation, because this is such complex language, and the difference between a copay and a deductible, you need to have a degree almost in insurance to be able to manage. And so I think the study really points out that there's policy gaps, there's educational gaps, and there's the need to increase awareness so that we're having these conversations.
Absolutely. And that causes me to think, and I think the gap was pointed out, but we keep coming back to the insurance system and the way it's structured. And again, this is a system I think that's primarily structured for people that will have in and out of the healthcare system with acute healthcare needs. And that is where the majority of people come and go in any given year. That is not the case for people with a chronic condition. And as we know, chronic conditions, as the American population ages, as we become better at diagnosing some of the challenges that people are having throughout the course of life, we're finding that's a significantly growing part of the population. So, in many ways, again, this research, this collaboration really calls attention to something that, if addressed, can improve the entire healthcare system for everyone. If you could briefly mention, I just have a couple more questions, and we'll go to the audience then, Grace, is that right? We keep coming back to the health insurance system, healthcare generally. In many cases, and I think this is true in Crohn's and colitis, IBD generally, autoimmune, multiple specialists oftentimes have to get involved. And I know when you looked at the gaps, there was both an access gap, a support gap. It might be access and supports to medical professionals that really oftentimes that falls to the patient to have to take their records and go place to place and try to make it all fixed. And you can imagine how both inefficient and how many times then that creates a delay or a problem in your treatment. But then there may be kind of people around the healthcare system, nutritionists and others. We talked about exercise as a way to maybe support caregivers, with families that could exercise together. Things that you might not call healthcare, but become part of a social determinant or holistic approach to health. Could you just touch on that a little bit, both the navigation of multiple specialists as well as those, medical professionals, and then also other supports that should roll up to be the kind of support system you need to get the treatment you need?
For sure. So in the area that I live in, we have a major university system that has a hospital, specialist, and fellowship program, and across the street from it is another major hospital system with its own set of specialists. They have an 8-month waiting list at times for most of the autoimmune-mediated diseases. If you're sick and you need to be seen by a new doctor, there is an 8-month waiting list. Most primary care physicians in my area will not treat your autoimmune condition because they do not want the liability and they have not had the biologics training. It's a catch-22. It leaves the ERs responsible for taking care of you. The ER doctors do not want to touch you. Part of my role as a patient advocate, I've gone and accompanied patients whose family members can't be with them because they're working. And I've sat with them holding hands in the hospital and doing the talking at times because they're intimidated by a doctor or the doctor has not taken them seriously. And sitting there with them, I constantly am seeing the inefficiency of the healthcare system. I watched an ER doctor not touch a patient physically who was in extreme pain, ordered a CAT scan, but didn't order contrast. And these are all things that if you were an inexperienced person, someone who does not speak English, you would never know to push for certain items. I also consider this a level of privilege. I lived a privileged existence. We weren't rich, but I was privileged in that I had a mother who advocated for me, and I learned to advocate for myself because of her, and then because I surrounded myself with people who were also advocates. Not everybody is as lucky in that aspect, and I call it white lady privilege, which I learned from a friend, and I take my white lady privilege very, very, very seriously, and I try to use it for the power of good as much as possible.
I will say, living in New York, we don't have quite the waiting list because of the plethora of specialists that are around, but I think when you go outside of those specialists and go to the ERs is where you encounter major issues. I think it was 2 years ago, my husband had to go to the ER. We weren't sure if he had food poisoning or a stomach bug or something, but he was sick. And we told them he has Crohn's disease, he needs hydration. So the doctor put in an order, I think, for 3 bags of saline. 3 bags came and went very quickly because, again, dehydrated because he's been going to the bathroom, throwing up. And they just left him sitting there with no more saline, just waiting. And he felt horrible. And I had to go and hunt down the nurse and the doctor numerous times and be like, he needs at least 4 or 5 bags of saline before he's going to feel better because he has Crohn's disease and he's dehydrated. And they wouldn't listen to me. And because of that, he ended up having to be kept overnight for observation so that they could then give him the actual additional saline hours later because they wouldn't listen to us. So I think more education among those providers who are not in the IBD space is definitely needed.
I do, though, want to end on a positive note about the healthcare system.
Oh, thank you.
There are groups like ImproveCareNow, like
Right.
the Crohn's and Colitis Foundation, that are working within the healthcare system to improve the quality outcomes, to really be focused on what matters to the patient and their family, to really meet the needs and overall raise the bar of the healthcare system. It's not something that happens overnight, but both organizations are trying to change the way people are cared for and the information that's out there, and make sure that the findings that we learn about ER management are, if you're not within one of those networks, that it's an education out to the professional community. And I think we have to partner as patients, and we also have to partner with the providers as well. Yeah.
Well, I do appreciate you saying that, because there are tremendous resources. It's just connecting to those resources at the right time and the right way and trying to get ahead of what might be a crisis. And then I think for what the report calls out, certainly what from the Alliance really focuses on, and then what is that unique role within the partnership, the healthcare team of the individual and the caregiver. And then because maybe the language is a little different, the understanding is a little different, both are highly invested in moving forward, but how do we get that? And I think the report really called out where we might look at that. Laura, if I could actually just continue in one more, because there's a lot of really great things happening. This is the right time for us to have this information move forward. Clinical trials, new discovery, new ways to treat or understand or diagnose these conditions. That's a pretty positive space. Some autoimmune diseases have never had a direct medicine for their conditions. They're now starting to see research coming forward. Can you mention that? And how do patients and caregivers even know about clinical trials, new medicines? What can I talk to my doctor about?
Yeah, well, first I think we have to start out by getting patients and caregivers involved in supporting medical research funding. We have to have the funding at the DoD, at the CDC, at NIH to really advance those new molecules or the new diagnostics and the new ways of monitoring disease. And then after we continue to increase that pipeline, clinical trials are so important. And one of the things that the foundation launched, and we did this in the adult community as well as the pediatric community, and we partnered with ImproveCareNow, was we developed a clinical trial community. And it educates about the facts, it creates materials so people can understand and not be misinformed about clinical trials, and understand the language of clinical trials, placebo, phase 3, et cetera. But it also puts a frame on clinicaltrials.gov that makes it a little easier to navigate and be very Crohn's disease specific, and ulcerative colitis specific, I should say, so that it's easier to navigate. And the education is both for the adult and the adult caregivers, as well as the pediatric patients and their caregivers. So I was saddened to hear that we needed more work in clinical trials, but I also am thrilled that we do need to do more work to raise awareness, because now we can get more people engaged and knowing that these resources exist for them.
The other thing I'll just follow up on, putting my foundation hat on, is as part of that we also have clinical trial ambassadors, who are people who have gone through the clinical trial experience and are trained by the foundation to talk about the experience and connect with others who are potentially interested in enrolling in a clinical trial. So that provides that peer-to-peer connection that I know a lot of patients find very valuable.
Well, that is very helpful, and I think that is I think there are resources there for patients and their caregivers to leverage, and there's so much more benefit to be gained by doing that together. So that's terrific. Thanks for sharing that. I think I'll just have one last call to the panel here in terms of thinking about the gaps, thinking about just how important this research is going to be going forward. And I'm thinking about, what can we do to support IBD caregivers in healthcare? And we talked about some of that, in family and in community. And then what about in policy? And I think we've touched on that, but kind of last call for me, and then I'll ask Grace to engage our audience. But just a final thought in each of those spaces, maybe.
Putting my foundation hat far, far away. This is just my perspective. I think more needs to be done to educate caregivers around family medical leave, as well as advocating for paid family medical leave. I think, FMLA is a great tool, and it does protect caregivers who need to take time off from work, but if you're not getting paid during it, that provides its own issues. So I think that's definitely an area in policy that we could improve upon. Now I'm going to let the foundation provide their perspective.
This report is going to be pivotal for the foundation as we respond to currently policy issues, informing, our work in Congress right now in supporting the Medical Nutrition Equity Act and other things, but it will also inform our next strategic plan. So we're ending our strategic plan in 2020. We're already beginning to think about our next strategic plan. And I feel like this work that we've done together is really going to help inform those educational gaps, those policy gaps, and how we can bring this all together, not just as our own foundation, but working in partnerships with others.
Terrific. Jamie?
Well, they definitely covered a lot of it. If employers in general, and especially if with the Family Medical Leave Act, if modifications were made where people knew that they could work remote, we are in a day and age where there's so much technology available where someone can do their job from home and do it well. It would open the door to so many more people with different disabilities, as well as their family members who are caregivers. So it's my hope that with more findings like this and more groups working together in tandem to make positive changes, that we will be able to have a better work-life balance and people can have better benefits from it.
That's fantastic. Well, and I'll just echo on behalf of the American Autoimmune Related Diseases Association, we are thrilled with this report. The data that comes forward, strengthened by patient stories and caregiver stories, is a powerful tool for us. This is a passionate community. And, when you think about people being involved in their health, well, you couldn't meet a community that by necessity is more involved and knowledgeable and striving to do the best for themselves and for their neighbors and for their community in healthcare. This report will absolutely allow us to go forward in that way. It just so happens that ARDA has been convening some organizations looking at the issue of fatigue. That is an issue that cuts across all autoimmune diseases. And we talked about fatigue for the person with the condition as well as for the caregiver. And this isn't simply being tired after a long day. This is debilitating exhaustion. And so we're looking to see if we can engage through PCORI, a research network across the country, to really look and see how fatigue is either a co-occurring factor because of everything that you need to do and everything your body's experiencing, or is it literally a co-occurring condition that's part of that autoimmune and chronic condition experience? These are the kinds of things that this report is going to help us be more compelling and convincing and be able to advance more effectively. So thank you for being here. Grace, I'll turn it back over to you. Thank you to the panel for your amazing insights. I really appreciate it.
Thank you. Thank you.
We have about 15 minutes for questions. Randy, I don't know if you'd like to sit in case there are already questions for the panelists. So any questions, comments, thoughts from the audience?
Hi, I was just wondering, one of the things that we know caregivers spend a lot of time and energy on is navigating the insurance system, obviously. And recognizing that that's always going to be a complex issue and one that's going to exist, what are the things that could ease that communication, ease that understanding and advocacy within that system? Just curious from your experience, what might be helpful?
So one of the things that we realized was that it's about navigating the insurance, but it's also knowing about the supportive resources that are also out there. So about a year ago, we launched our financial management portion of our website, which has insurance definitions, steps to think about when choosing your insurance, especially for someone with a chronic illness. But we also put in information about the available assistance programs, a one-stop shop for the available assistance programs. And that includes the industry-supported, but also the charity-supported assistance programs, because we were at a focus group once and someone mentioned that they had mortgaged their home because they couldn't afford their medications, and that broke my heart, and they were on a therapy that there was an available assistance program for, and I was like, we need a one-stop landing place for all this information. So we've gone about doing that. And this year, later this year in October, to get for that insurance roll-up season, we're launching resources for young adults entering the insurance space for the first time and helping them ask the questions they need to make the decisions around coverage for themselves. And then we also recognize there's a shift when you go from your employer's sponsored plan onto a federal Medicare plan. So we're also creating resources for the older adult with a chronic illness, Crohn's disease and ulcerative colitis in this case, to be able to navigate and ask the questions appropriate for it. So I think there's always going to be more done here, but those are the steps we've taken so far.
And I would just add that if you have a good relationship with your doctor can be a really good resource as well. And I'll make a plug. We're actually doing a Facebook chat next week with one of our docs about health insurance and kind of navigating the appeals process. So, you know, your doctor is definitely a really great resource to assist as well.
I also want to add in something that I'm noticing happening often when patients are going in, even if they've met deductible, that they're told that they have coinsurance. They don't have a copay, but they have coinsurance. If they have met their full deductible, they do not have coinsurance anymore, but they feel powerless. It is actually your doctor's office responsibility, if they have an insurance person there or a billing person there, to call and speak to your insurance company, because sometimes the computer just doesn't go through and they throw it onto you. So what happens is you pay something and you have to wait the entire year, if not 2 years, until they audit and realize that you've overpaid. Sometimes they don't pay you back until you tell them that they have to. So people are going into debt. Another reason is if you have to pay your copay in order to see your doctor, and your copay is hundreds of dollars. Resources that the foundation has put forward with these foundations also, that they're helping you get the money in advance so that you are not having debt sit on your credit card, bills go unpaid as shown here. Your credit is your livelihood, as most people know, and one of the biggest things that are dragging us down right now is medical debt.
I would just to reinforce that, I think there are tremendous reasons for us. There's tremendous value for us as a community representing patients and our part of the healthcare system representing caregivers to really ensure that that dialogue is taking place with insurers. Many insurance companies, particularly in the Medicare Advantage space and other spaces where the insurer has a responsibility for a person, whether they have a chronic condition or relatively healthy, over a period of time have really developed some amazing supports. And I don't think there's enough understanding about what those are and how we can, try to leverage those and help other insurers see the value of taking that direction. And then I know something that the National Alliance for Caregiving has looked at is, and to what degree are caregivers and their role, their costs, supports for them reflected in that more holistic approach around an individual and helping them with their health and well-being. And that, I think, is something that we could build on as well.
Oh, yes. Grace, I love the data because I come from a data background myself. And one of the things that I noticed here was on the impact of providing care. It seems very evenly divided between my role as caregiver gives me a sense of purpose in my life. So there's the extreme 23% that says, not at all, and then 21% that says, yeah, absolutely. So I was wondering, for those of you who are experiencing Crohn's or perhaps are a caregiver for Crohn's disease patients, was there an inflection point in when you went from the side of, this is really just something that's happening to me, to, hey, I'm actually finding some purpose out of this, and how did that shift your perspective on the whole experience?
100%. I would say that when my husband was first diagnosed, again, we were dating at the time. He was living with his parents, so I didn't really have to do anything for him. I didn't really grasp what the disease was or understand that it would actually, impact me. I think when we got married, moved away from our family, and I assumed the role as his caregiver, and he got really sick really quickly, it kind of clicked for me that I needed to get my stuff together to be able to advocate on his behalf. And I think after that first hospitalization where the insurance company was out to lunch, which still blows my mind, and I basically had to force them to do a scan without authorization, was my turning point of where I saw myself, having a purpose and really being the voice for him, because he was not in the position to be able to push them himself. And so I've taken that, and I got very involved in I call myself a patient advocate, but I'm a caregiver in that community, and then eventually turned it into my full-time job, which I feel really lucky to have been able to do.
So in my case, I was a Crohn's patient for the majority of my life. Even after my diagnosis at age 23, once we knew what was wrong with me, I did not identify as one. It wasn't until I had lost everything and felt a little bit listless and floating that I found purpose in trying to take back my power and learning about the disease. And then when I realized how much bad information was out there in 2012 especially, that taking back my power helped me identify as a patient, but I wasn't just solely a patient. And then when my nephew started getting sick, I took that power that I had and I put it to good, and I made sure that we figured out what was wrong with him, one condition at a time, and teaching his mother as well what she needed to know, and she has done magnificently since then.
The one thing I just want to add also is that because I had nobody who could really be there to relate to me and support me through the journey, now when I meet other caregivers, I've found that my purpose is to be supporting them. So for example, I'm going to refer to him as my cousin, but he's really my cousin's cousin and not related to us. But for easiness, my cousin has ulcerative colitis, and he's going through the 3-part J-pouch surgery series. So first surgery was removal of the colon. I reached out to his wife because I wanted to see how she was doing, because they have infant twins and a toddler, and she's had cancer, and I wanted to make sure she was okay, that she had the resources she needed. I went to the hospital and visited them. So I find myself, feeling lucky that my husband is in remission, and now finding purpose in reaching out and connecting with other caregivers so that they don't have to feel like I did when my husband was sick.
That's great.
Yes, I have a question regarding caregiving. I experienced this on both levels. A caregiver that's caring for someone, a spouse, a significant other, or partner, versus a caregiver taking care of their mom or dad. Now, dealing with the emotions, what suggestions you may have for one versus the other? Because with a partner, you're building a relationship, and you're used to being with them on a certain level, but they diminish. But with your mom or your dad, they brought you in the world. They're getting older, and I've dealt with both in the last 2 or 3 years. Currently with my mom. But what suggestions or advice you have for caregivers to deal with both?
So I've also dealt with both over the last few years. And it's a really funny balance. So with my husband, I feel like I have a lot more control of the situation, because when it comes to his health, he typically won't argue with me when I suggest things or push for him to do stuff that he's supposed to be doing. But with your parents, they still look at you as their little kid. So I had to take my dad for a pre-op appointment once, and I started asking lots of questions, like he had to have a hemorrhoid removed. So I was asking, are you going to have internal or external sutures? Are they going to be dissolvable, or does he have to have them removed? And he just looked at me and he was like, who are
That's
you?
Right. Whole different language.
So I think it's, with parents, you have to kind of toe the line of not being too bossy, and still being their child while also supporting them. It's definitely an interesting dichotomy, because with my husband, I can really just be no nonsense, no holds barred, and with them, I kind of have to handhold.
Yeah. I'm definitely in that situation right now, caught in the middle as a patient and caregiver. My mother for years was my primary caretaker from childhood and when I moved back in again. And she put my needs above her own. When I got married, she decided she wasn't going to go to the doctor for a year and a half because she had a wedding to plan. And in that time, she developed something, and we are dealing with that now. And so now my role has shifted from being the person that she normally cared for to being the person who's over there after her treatments and taking her to appointments if my father can't, because my father is the only one working right now. So it's definitely an interesting dichotomy where I'm the one who's being bossy in the appointments and versus her. And the same thing with my husband, who avoided doctor's appointments for years. Sure. And I made him, at the age of 40, go to his first dermatology appointment since high school. We live in Florida. You need to go every year. So I'm happy that he just went, and and he's finally taking care of his health. And it's one of those things where he's always like, I need to work. I can't miss a day of work. He has so much vacation time. I'm actually making him go on vacation on Friday, and I'm staying home with the dog, and he's going on his first 10-day vacation in forever because the dude needs a break.
The only thing I would add, I think it's really important for you to find support for yourself. I think caregivers often take on so much, and they take it on, and they don't have that person that they can talk to, or that support system, whether it's a live person, a peer, or even an online community that you can just share your feelings and your frustration. And I'm dealing with parents too, and sometimes you just want to pull your hair out, but you have to have that outlet to support yourself, so you maintain your mental health and you decrease your stress levels as you're navigating on behalf of both groups.